So I'm going to turn it over here to your presenters. I'd like to introduce Mitch Myers, who is the CEO of Belief and also a charter member of MoCannTrade, the voice of trade for medical cannabis in Missouri. Mitch has been involved in the industry for quite a while, and many of you might know her from her previous background working in beer and spirits, as well as the advertising agency world. And with Mitch is her director of cultivation and also MoCannTrade's board of directors co-chair, John Curtis.
Hi, everyone. Cannabis can sure pack the house. How many of you have any involvement in the cannabis industry? Oh, that's pretty good in Missouri. My background is marketing, as Andrew said. I worked for the Anheuser-Busch Company, for 7-Up. I had my own agency for a while. We did a lot of great fun marketing for big clients. I retired in 2003. Ended up spending a little bit of time in Colorado where my kids were going to college and watched the medical cannabis movement happening there, and I was absolutely blown away at what was going on. Ended up finding a friend that was a caregiver, was treating people with very serious conditions, having some great success. And about that time, Illinois was passing a statutory bill through our legislature that was creating a very restrictive medical bill. And there were not a lot of licenses given out. It was very political, but I was lucky to get together with a team and apply for a dispensary license in Chicago and received it. So since 2015, we opened that dispensary. I have learned a great deal from our patients. We have about 900 right now, and it's just been an incredible journey. So in 2015, there was a very quiet, narrow bill that opened up in the state of Missouri, and our attorneys actually called and said, "Are you going to apply for this?" And I said, "No, I got my hands full." And they said, "Oh, yes, you are." So I got down to their office. We went through the application process, got it filled out, and about 3 months later, my phone rang. It was the head of the Department of Ag, and we were one of lucky 2 licenses. For the last 3 years, and not a lot of people are aware of this, we have actually been cultivating brands of cannabis that have very low THC and a good level of CBD in it, and we are extracting the oils from that plant and making tinctures for epilepsy patients. And these patients have to be intractable, meaning they've gone through 3 different drug protocols, and if you know anything about that disease, it's very difficult, and the drugs make it even worse. So we end up seeing sort of the worst of the worst, people who really don't have a lot of hope for anything working for them, and it has just been amazing how well this very simple oil prepared from this plant. So John and I have been working with the New Approach people and also with the legislature for the past 3 years trying to get something passed for a broader medical bill in the state. And we struck out 3 times with the legislature. It's very conservative here, obviously. I don't think anybody travels to any other state in the union and knows what's going on. But we realized it wasn't going to happen, that the voters had to bring it. And you brought it. It was just incredible a little over a week ago, and we're very pleased that all of you did speak up. So tonight we're going to talk to you about what does that mean? Where do we go from here? And MoCannTrade is a trade association that's been put together in the last 6 months to really make that happen in a sensible way. And that's going to be good for the business owners that want to participate, for the patients who want to get cards, and for physicians who want to be part of the process. So you overwhelmingly voted yes on 2. If you look at, there were 3 amendments. We were so desperate to get a bill that literally 3 amendments got put on there, and that is no small feat. A lot of time, energy, and money to get that done. But as you can see, Amendment 2 won outright with 1.5 million votes. What I think is absolutely amazing is it's 418,000 votes higher than the hotly contested Hawley-McCaskill race. So that tells you that people came out and voted for this and nothing else and walked away. And I will also tell you that this has the attention of our legislature now. Our governor sees this and said, the people have spoken, we know what they want, we're going to bring this bill in as quickly and easily as we can. So most of you know that there's a 4% tax on the retail sale of marijuana with this bill, and that 4%, the funds developed, will go to set up the department that will administer this, which is the Department of Health and Senior Services, and then what's left will go into a fund for veterans. And the veterans came out, the VFW came out in support of us, which was very helpful in the end. We are also estimated to generate annual taxes and fees of $18 million for the state operating costs and veterans programs, another $6 million for local governments, and the annual state operating budget is estimated to be $7 million. So MoCannTrade is the voice of trade for the medical industry. And we want to make sure that this is a compliant, safe, successful program, and it supports stakeholders and regulators through education, advocacy, and responsibility. One of the things that we have seen in other states is that maybe the doctors don't get behind it in the early days, and that creates a logjam for patients getting cards. Part of what this trade association is going to do is put together a physician and practitioner education piece. So again, we now know enough. There's 31 other states that have already done this. Let's take best practices and let's put together a teaching module so that physicians who didn't learn this in med school feel comfortable actually allowing a patient to get access. And there's a bit of confusion on, do doctors prescribe or do they just validate that someone has the condition? And it is the latter. They do not prescribe, and that's for some liability reasons. But most good doctors want to have a bona fide relationship with their patients. So they want to stay involved. They want to learn. They want to know what they're actually taking and what effect it has. We also have a rules and regulation development committee where some of us who have cannabis experience are actually working with and through the Department of Health, because they're on a pretty short timeline to turn around these regulations so that people in this room who are interested in applying for a license can do so. And then we have member fellowship and advocacy levels. We encourage all of you to join at any level you feel comfortable, because this is the group that you're going to stick close to learn what's going on, when it's going on, and how you might network with people. You may want to open a dispensary and you don't really have the cash to do it. There might be others that just want to invest and they don't want to operate. So these are the kinds of events where circling around MoCannTrade that'll put you guys in touch. So the timeline for implementation. Obviously the bill passed a week ago, and 30 days in, it goes into, it's actually effectively law. So December 6th, it becomes the law of the land. On January 5th, the Department of Health will be putting on their website the form that allows people to pre-apply for applications. And this is where you will pay your fee if you're going to apply for one dispensary or 3 dispensaries or 1 cultivation and 1 manufacturing. The fees are all outlined, and we'll talk about that in a minute. But this is where you sign up, let them know you're going to apply, and pay that fee. You will then, in June, they will publish the applications, forms, and instructions for people to actually make the application. So in that period of time between January and June, you now know you're applying. That's when you want to, get out and start finding real estate, getting your team put together, and then when that application hits, that's when you actually start doing the term paper and getting it ready for submittal. Prior to that, though, they will begin accepting patient and caregiver applications. So this happens in July before anybody's even been told that they have a license to produce or sell. Part of what that does is tell the Department of Health what sort of demand, and it also tells the business owners what sort of demand there's likely to be. In August, we will see the applications being posted online. It'll be very detailed, what they're looking for in their submission. And then they want them turned in by August. They will then get another 60 days to judge, and we should know by next year, before the end of the year, who are the applicants that are going to receive licenses. So what's the economic impact? From what we can see around the country, there's really no signs of slowing down. You know, we were a little concerned about the federal government when Jeff Sessions was in office. Now he's gone. We think that Trump is going to make a move to potentially deregulate, and what that might look like is what happened with alcohol back in Prohibition. They said, we'll leave it up to the states to regulate, because that's where we are today. You know, we have 31 states now that have passed medical, another 9 that have passed recreational. So there really is no slowing down to this. And it's quickly becoming a major job generator, and it delivers taxes. So when you start looking at states like Michigan just went recreational, Illinois will likely go recreational in the next 18 months, New Jersey, New York, they look at those tax dollars created and they really need them and can't say no to it. The interesting thing is, once we bring in these programs to these states and we create the jobs and the taxes, there's a follow-on effect with all the businesses that benefit. And we'll talk to you about what those businesses are, but it's like a $3 multiplier for every dollar made in the cannabis space. So nationally, there's the medical states, and then there's the recreational states. And there's many fewer recreational states, but you can see it pretty quickly outpaces medical. So by 2021, they're suggesting that we could be seeing in the $5 to $6 billion in revenue for medical, another 7 to 10, with a total of $17 billion in revenue just from the cannabis business. Here's the follow-on dollars with adding, $3 economic impact of all the ancillary companies and services. That gets us up to $68 billion. And what about jobs? Right now, they think that there's 45 to 60,000 jobs in the dispensary, so the retail license store that actually sells it to patients. And then the wholesale cultivators, the operations that grow the plant material and either sell in packaged flower or sell that off to a manufacturer. Infused product manufacturers are the places that actually take the flower once it's dried and cured and make products out of it. So they may turn it into an oil or turn it into an edible or a topical. There's a lot of creativity going on in the industry right now in terms of what they're doing with cannabis. And then testing labs. Every state has to have a certain number of testing labs because all the product before it goes to a consumer has to be tested. So the industry employment estimates for 2021 are 430,000 to 630,000, and I think we'll blow right past that, to be honest with you. The estimated total economic impact in Missouri, we're looking at upwards of $500 million. And again, these kind of numbers get the legislators' attention and truly the governor, because there aren't a lot of things coming to this state that's a job creator like this. So broadly, there are 2 types of groups that we talked about: licensed medical, cannabis business, so that would be cultivation, manufacturing, dispensing, and testing. And then there's the industry supporting, or what we call allied businesses. There will be 332 medical cannabis business licenses available with Amendment 2. 60 cultivation and agriculture, 80 manufacturing and extraction, 192 dispensing and patient care, and that's a minimum. That's based on 24 dispensaries for every congressional district. And we have 8 congressional districts in the state. So there will at least be a minimum of 24. And they can add as population increases or as they see the need. And there's a minimum of 2 testing labs, but I would suspect you would see, you know, quite a few more than that. These are merit-based license. And what that means is the Department of Health will establish a grid that tells you all the different things you need to report, and they will apply a numerical system to that, and it will be based on what they see is important for winning a license. So all of these applications are going to be judged either by their staff or a third-party group that they may hire to do it. And I suspect we're going to recommend that they hire third-party, because if they get 700, 800, 900 applications, there's no way they're going to be able to pull it off. Yes?
Do you have a feel yet for how the felons are going to be treated in this process? If you serve time for marijuana and you're good at growing it, are you going to be excluded from the industry that you helped create?
I believe there's a 5-year, if it...
There are 3 provisions in Amendment 2 that deal with this. So if it's past 5 years, you're probably okay. If it was done for medical necessity, you're probably okay. If it was...
Well, I'm okay. I'm talking about...
yeah, somebody I know.
I, of course, meant the royal you. But yes, there's a provision looking out for people who who are so-called victims of the drug law.
Right. So this is, you know, applying is hard, but we think it's fair. This is actually a picture of the conference room when we were submitting our application for our dispensary applications in Illinois. And what you have to do, I mean, they're going to look at your character, veracity, your background, relevant experience of officers or principals. They want to see a business plan. They want to see numbers, pro forma. How much do you think you're going to grow or sell, depending on what kind of license you have? You know, what are your connections in the community? How are you going to give back? What is your legal cannabis market experience? You know, a lot of us in the Midwest didn't have it. So you may have to bring people from other states that have done it. And I think that, you know, a lot of people who lived here and moved away, like John, got involved, got their experience, and then came back. So I think we'll be able to find people, you know, to help in that regard. So you want to go from here?
Which one takes us forward here?
To the right.
Okay, great. Yeah. Hi, everybody. Hey, that's my grow. Okay, so as Mitch said, the wording of Amendment 2 gives a certain number of licenses based on population. Some of them, the dispensaries in particular, are doled out based on congressional district, but cultivation and infused products are not. Infused products is a term we use in Colorado. Here, I believe it's called manufacturing. There will be 60 cultivation licenses available. These cultivation licenses will be either of the greenhouse or indoor variety. You'll get to determine a grow style that you're interested in. You'll have to provide all of this stuff to the state in the form of an SOP if you're interested in applying. So you'll have to secure real estate, identify and organize your team. That requires a lot of logistical support, attorneys, accountants, banks, financing. That's huge. We can talk a little bit about that later. You'll need somebody who can create pro formas, business plans, and it's not cheap. So I do everything cheap. So I'm like on the low end of that scale, but it's expensive. There's no way around it. Yeah. Well, it's not an easy answer, and there's not one clean answer. So a lot of us have always had banking relationships, and that's just based on personal relationships with banks, and sort of sometimes they'll say, well, we'll take you, but we're not going to take somebody else. And that's maybe you were banking there for 5 years prior. in the 6.5 years that I owned 3 dispensaries and 3 cultivation centers in Colorado, we always had a bank. It was a major nationwide bank, but the rhyme or reason is hard to say why some people get kicked out of the system and others don't. The banks definitely want to participate. They want these deposits. The issue is that although the Justice Department has issued guidelines allowing banks to do this, the attorneys for these banks are by their nature very conservative, and they say, these are just guidelines, the law hasn't changed. If you do this, you're exposing yourselves to potential prosecution should the regime in Washington change again, a la Jeff Sessions. Now, he's gone, and that never transpired, but nonetheless, to banks, it's a potential liability. So there's going to be 80 to 88 manufacturing licenses. It depends really, all of these license numbers are dependent on the actual population. I think they're going to use the census numbers from 2010, so it might be a couple lower than 88, but these are approximate numbers. Manufacturing licenses will, just like dispensaries, you have to secure your location, determine the products you want to manufacture. You guys know what this stuff is. Gummy bears, vape pens, those are all the things that are manufactured by infused products license holders. The testing facilities it is required there be no fewer than 2. It's almost a certainty there will be many more. 2 testing facilities in a state with 60 plus cultivators and 80 plus infused products manufacturers is unworkable, so we imagine that HSS will increase that number. We also know there are a lot of people who are interested, both out-of-state laboratory operators and in-state lab operators who don't necessarily have cannabis experience, but they've got deep lab experience. They want to be in this space. Testing facilities will have to be licensed. There are some other allied supporting type industries that can't be licensed. That's a particular word. When you use the word license, it means certain things according to Amendment 2, but it's likely that there will be a process of certification for other people who are involved in allied industries, but testing facilities will actually have to have a license as provided for in Amendment 2. It's at least $1.5 million. Those things are very expensive. Dispensaries, even though I come from the cultivation side, and when I'm done blowing through these so I can get to your questions, which I know you have a lot of, I'm going to give you a very brief background, and then we'll get to those. But despite my background in cultivation, I love the dispensary model right now. I think that, and lots of people disagree with me on this, I think dispensaries in many ways are the place to be because there is the possibility of disruption for their business model, I believe to be less, and I am by nature an orderly person. So dispensing, licensing is 192 in the state, 24 per congressional district, as Mitch mentioned. The process for all of these is the same. You will need real estate professionals, you will need architects, you will need accountants, you will need attorneys. Many of them charge by the hour. So you'll need security consultants. Lots of security folks have joined our trade organization because they know in other states security has done very well on, cannabis has done very well for those folks.
Can I just say one other thing too? In my experience in zoning meetings and city council meetings, the dispensaries are more of a lightning rod than cultivation and manufacturing. Typically, you're going to be in a manufacturing section. People don't really see what you're doing. They see it as jobs, and they see it as very controlled and secure. But when you start talking to communities to put a dispensary, you know, maybe in a downtown area or someplace that's very visible, sometimes you can find city councils that get really nervous about that. And we struggled with that in Chicago. And in Missouri, they cannot really turn you down. They can zone you into a classification. But if you're interested in going that route, the sooner you start talking to that city and finding out what their views are on it, have they talked about it, have they had a meeting? Because sometimes that can take 3, 4, or 5 months for them to get through their cycle. And you don't want to go put, you know, some sort of a down payment on a building and then find out the city's not going to approve it. So
That was valuable IP I would not have given them. So, dispensaries are not quite as expensive. They're still pricey. There's no doubt. This is far different than it was in 2009 when I moved to Colorado. I think we opened our first dispensary for like $5, and that is not going to happen anymore. Transportation is one of those areas where I think it's possible we'll see some allied industries that will go through a certification process. That's very up in the air right now, but they are not required per Amendment 2 to be licensed. Transportation is important because it's very rare these days to have a co-located cultivation, infused products, and dispensary. I actually had my first grow in Colorado was in the basement of a building in the Rhino district of Denver, and our dispensary was upstairs, and gosh, was that nice. That is almost never the case any longer. And the product has to go all over the place. It not only has to go from the cultivation facility to the dispensary, it might have to make a pit stop for testing. So transportation is an issue in this industry. Hey, that's my grow too. So the industry will have service providers. They will be more than happy to take the large sums of money that some of you will be spending to get in this industry. And here's a whole list of them. I'm not going to go through every one of them because I'm trying to get through this. Lots of economic impact. Mitch already talked about that, but the CPAs and the attorneys do very well, no doubt about it. Same thing, you got that. Okay, so electrical, lighting, economic impact. How you do what you do, how you design your space, whether it's a greenhouse or an indoor grow facility, is incredibly important. We were working on a project the other day where we thought it was going to be $3,000 each for this thing we were trying to do, and we got working with some designers and got that down to $600 in about 2 days. So good design, good layout, thinking, not doing this at the last minute, but really having a plan and sticking to it will save you a lot of money in the cultivation business. There's going to be a huge design build economic impact. That's why there are real estate people listening in this audience right now. Security services, we talked about that already. They do well. So that's us. If you look in the back row towards the middle, there's one particularly handsome guy. And there's a bunch of other folks in there who are really interested in making this an excellent industry. Many of these people, I think most of them on that screen, are not going to be license holders. We have a board at the Trade Association full of people who are interested in the industry. They're interested in helping the state of Missouri. Some of them are interested in being license holders, but most of them aren't. We have a lot of doctors. We have people who are patient advocates. So this is being taken very seriously by this trade association, and we exist to try and do the right thing in terms of working with the state to create an industry, and we think that's what this will become here. So if you want to get involved, they can also go to the website. Andrew, is that right? Some of this information is on the website, MoCannTrade.org. And the good folks on that table right there are working to develop a conference that they would like you all to come to. It's going to be full of interesting products and help and information for you all to get into the business. Now is the fun part. So before I answer your question first, sir, I'm going to give you like a 45-second background because I love to talk about myself. So I was a just say no kid. I believed, right? And I did not ever smoke cannabis in high school. I swear from my lips to God's ears, that is the truth. And I had a terrible, terrible teenage romantic breakup, and I was really depressed, and my friend brought over a joint. And I smoked that joint with her, and I knew then that those bastards had lied to me. They had lied, And then, of course, right, the next thing you think of is, what else did they lie about? Right? And so I discovered on my own they didn't lie about everything, but they lied about cannabis. So then the next thing that happened is a year later I was in Los Angeles visiting my uncle for the summer, and I was hanging out on Venice Beach, and there was this guy named Jack Hare who had set up a booth called, and he had a big banner that said hemp, help end marijuana prohibition. And so I ended up, a really long story, very short, I ended up working for Jack for 2 summers, became a journalist, interviewed him several times over the years, along with a lot of other people in this industry, Dennis Perron, who's no longer with us. And maybe a year or 2 after that, in college, I was actually not a huge consumer of cannabis, but a year or 2 after that in college, I started upping my consumption of cannabis. And so this is like 94, something like that. And the guy down the hall, it was $100 for 7 grams of good cannabis. And in 1994, the price of gold was $280 an ounce. Now, an ounce is 28.7 grams. So anyway, you can imagine the machinations that started taking place in my mind. And so that really is what has brought me, took me to Colorado and California and all kinds of places to grow cannabis. In between, I somehow found time to work as a journalist for 10 years, which I greatly enjoyed. I'd go back to it in a second if I could make a living at it. Other than that, we'll be thrilled to answer any questions you might have, starting with you, sir.
So first thing, can we get copies of the slides?
Andrew, can we give copies of this out?
We're actually videoing this whole session, and so we'll post the presentation and the video on our website here in a couple days. Thank you.
Who else? Come on. I know you're out there. Yes, sir.
So there are certain conditions in the amendment that qualify. Cancer, ALS, Parkinson's, PTSD. I think there's 12 or 13 different conditions that are called out. And so if your doctor signs the form validating that you have one of those conditions, or you suffer from some sort of chronic pain as a result of one of those conditions are worse, which is really what we need to make a program. So that chronic pain is the human condition, right? Everybody's got something, and it depends how aggressive your doctor is willing to be. And we honestly have 4 doctors on this board that are terrified of what's going on with opiates, and they're looking for this as an off-ramp. So it has been proven with research, and we've got WashU researchers that have done this already, that if you can help people come down off opiates by taking cannabis, they can bring it below an addictive level. So we believe that's sort of a game changer, and why we have a terrible problem in this state with opiate addiction. And we think that we're going to see the doctors aggressively look at this as part of the solution and not part of the problem. So that opens a broader canopy. Yes, ma'am.
So how would the dosing happen? Who's going to be responsible for the dosing?
So right now, when we're working with epilepsy patients, Cardinal Glennon physicians are very involved. They have been working with us since day one, and we work on that dosage. California's had medical cannabis for 20 years. We're not inventing this. So there is a lot of research out there. There is, we have talked to doctors in California and Colorado when we have dosing questions, but it's kind of based on what people have done in the past and what they've had success with. So the dispensary personnel need to get educated. And we're looking at another teaching module for dispensary personnel in case their doctor isn't involved to help them with dosing. The good thing about cannabis is you can't overdose on cannabis. So it's not like, an opiate that if they take too much, they could really hurt themselves. No one's ever died of an overdose of cannabis. So it's a little bit of a trial and error. Yes, sir. No, it'll be a free market. So the products are going to be developed by the cultivators and the manufacturers, and they'll determine what they want to produce and make. The Department of Health may, in fact, request or require that dispensary personnel take a training module, just so that there is a basic understanding. And it's very helpful. I mean, if you hire people that have never done this and aren't cannabis consumers, you know, somebody comes in with stage 4 liver cancer, they need help. And there is help out there. There's information. Yes, sir.
Is there any information about cannabis helping people get off methamphetamine? Or that
I believe there is. We have a researcher at WashU, A.D. Poe, and she has had a NIDA grant for the last 3 years and has proved it in mouse models. A lot of doctors don't respect mouse models, but that's where you have to start. But I mean, some of these methadone clinics are really looking at this as a step down. You guys are going to have to yell out. I see too many hands. Talk.
Go ahead. Gentleman in the gray shirt right there. Go ahead.
If you were to open a dispensary, would all the product have to come from inside the state of Missouri, or would any product from out of state be allowed in?
No, nothing can cross state lines. Everything is grown and manufactured here and has to stay within the state.
Follow up on that. How do you feel that if there would be disruption in manufacturing and grow operations if it is legalized across the United States? For instance, is California going to dominate the supply?
It's unlikely that the federal government will just say, we're going to legalize it. What's more likely is that they will reschedule or deschedule, and in order to avoid having to go back to the part of the country or their constituents that don't want this, they're going to say, listen, we're not doing anything. We're just going to say to the states, do what you think's best. And so there will likely be intrastate but not interstate commerce. This will all take place for a while. At some point, the model that you're thinking about is probably accurate.
Could you guys make sure you restate the questions, because they're streaming it outside, and so people don't hear the question and they can't.
Okay, sure. Yes.
What about the distribution of dispensaries? And are they going to take in the idea of proximity to each other, and will cities tend to cluster them, or will the applications be spread out?
Well, that's something that we've been asking ourselves. We know that they will be. So the question was, where will the dispensaries be placed, and will they be clustered in population areas within the congressional districts? We know there will be 24 dispensaries in each congressional district at a minimum, and it's likely that that's where the state will start. As far as what type of strategy the state will have for determining those locations, that remains to be seen. I think the thinking on the part of the authors of Amendment 2 was that if they called for a minimum per congressional district, no congressional district in this state is so big that 24 in that space, so there would be a dispensary somewhere fairly accessible for most people. Yes, ma'am.
So I know that minorities have been affected with high incarceration rates, and I see, like, obviously the representation in this room is low, and when I look at documentaries in Colorado and other states, is there funding available for minorities to do this?
From who? So the question was, is there funding available for minority groups? I'm going to let Mitch answer that, but I would just say that, to my knowledge, there are no grants for the cannabis industry. There are programs, however, that are out there that attempt to bring in underrepresented groups into the cannabis industry, and typically in this business right now, the underrepresented groups are women and people of color. So there are trade groups and organizations that have formed to attempt to address that. To my knowledge, they do not give out grants. Okay. Who are those groups individual? I don't know. I've read about them so Cannabis Business Times, is that the magazine that?
Right, but Missouri in particular, I don't think people have stepped up and said, we're going to support minorities. You may.
Would the Rules and Regulations Committee be able to do that?
The Rules and Regulations Committee can put in some of the verbiage that you get bonus points for having minorities or veterans.
A certain amount of minorities that get granted the licenses, is that possible?
It has to be in the language of Amendment 2, which it currently is not. Is that correct?
It is not. And if that were attempted to be put in there in the rule-making process, it's very likely that people who were denied licenses would sue. So if it's not in the language that becomes law per the Constitution, then those goals have to be achieved in ways that would likely survive a legal challenge. What you described, based on my experience in other states, would not survive such a challenge. You had a follow-up to that, sir? Go ahead.
With that question, myself as a minority, I've seen across other states that there have been concerted efforts to include in the application process bonus points for women-owned operations, minority-owned operations, and veteran-owned operations. So, follow up on that, is there any push through the Missouri Trade Association to put that legislation on the books?
So what we can do is make recommendations to the Department of Health. And to John's point, anything that actually changes anything in the law is a little problematic, and that's where lawsuits can happen. So if we can position it as, and this is what happened in Illinois, they didn't require a percentage go to minority, but you got great bonus points if you outlined your minority program. Some of them, Florida, I think, minority involvement was like the highest point getting thing. So this will really be up to the Department of Health without changing the law that's currently on the books. Because again, we don't want to get caught up in lawsuits and just freeze the program for the next 2 years. There's always the ability to get add-on legislation. Next year, something could be put into the legislature to add that. I would like to see research added. That would be something as well. I know in California, they have a huge push, but it's 20 years into it. They have a huge push to involve minorities, especially those that were incarcerated for cannabis. So they almost get to come to the front of the pile.
So I think the closing on that, we'll go to something else. What's likely is that in the application judging process, there will be some value added for that criteria, depending. But to call out a specific number and say this many licenses shall be awarded or a percentage, right? But that would still correspond to a specific number. That is not something that we could ask them to do because it doesn't appear in the law. That couldn't take place in the rules-making process. The only thing that we believe could take place in the rule-making process would be to give people a bump in their points that judge these applications based on those criteria. That is very legitimate in our opinion.
Yes, sir.
Yes, sir.
What is the job of the testing companies, and will there be a local body that controls the quality and certifies the quality? And my last question, obviously, is that does the dispensary have to have any form of insurance to cover, I don't know, malpractice or incidents or side effects?
Yes. So his question was, who certifies the testing lab? And there is a national organization, ASTM, that certifies labs. But it's going to be very important that the equipment be up to snuff, that the standards that are put in these machines are up to snuff. It's very expensive equipment, and the calibration is an ongoing thing that you're maintaining because you will be testing flower in its original form. You'll be testing every sort of produced product, whether that's a concentrate, an edible, and you have to do that very quickly and turn that around because that information gets put on the packaging. The state will set a guideline that will tell you what the standards are, and I'm sure that there's going to be some checking and calibration on that.
What body of the state is that? DHSS?
Yes, yes.
So the question was, what are the testing standards that will be applied, and do dispensaries have to have some type of malpractice or liability insurance? the entire program is run by Health and Senior Services, but they are allowed per Amendment 2 to farm out some of the responsibilities. It's likely that they will farm out some of those responsibilities to state agencies that have more experience than they do in these other areas. For example, when we sell this product, typically it's done by weight, which means we have to have scales on site. Those scales will have to be calibrated. The Department of Agriculture has a lot of experience calibrating agricultural-based scales. They will likely be brought in for that portion. You want to? Did we get to the part about insurance, or do you know?
Insurance. Most dispensaries have a typical blanket of insurance for liability. The product liability comes from the manufacturers typically, and you get indemnified. But all the typical insurance is available to the dispensary personnel.
Quick question on the impact. We're talking about the economic impact of the state. And one of the things that I saw on your slide, I believe it was $6 or $7 million for operating costs by the state. What?
The
It would cost the state government of Missouri around they're budgeting $6 to $7 million. No.
So the question is, was there a slide that showed the expenditure that the state will have to incur in order to regulate this industry? I'm sure there was one of those slides.
I believe it was like $6 million.
Yeah, I'm getting to it.
Yeah.
So
This one. All the money that's budgeted for the program is coming from the income that the program generates. None of the money that is for the program comes from tax dollars that were paid by anybody other than people applying for licenses.
Understood where the money's coming from, that the industry has to pay the state, right?
Right.
yes.
Where did this operate? How did this budget come about? What would be in the budget? How can it seems like it's ridiculous.
So these are estimates. Anytime that there is a law passed, whether it be statutory or constitutional, there has to be a cost estimate to the state attached to that legislation. Often it's wildly inaccurate, but nonetheless it's a legal requirement, and it's like this in virtually every state across the country. Any law that gets passed, whether it's by constitutional amendment in this case, or statutory through the legislative process, has to have a cost to the state attached to it.
But I would contend that probably that number is not far off, because Department of Health is going to have to create an entire department to write the rules, judge all the applications, get all the cards out to people, which is a never-ending thing, monitor all the different licenses. They can bring in the Department of Ag for cultivation, which they are likely to do. We have the Department of Ag, we have one guy that's assigned to 2 different licenses in the state. That's all he does. So, you know, I don't know how they make their budgets, but I can tell you the Department of Health will have to add substantial number of people to make this project go.
This side of the room is being ignored.
Yeah.
Yes, sir. Yep, you.
A question about supply again, back to what this gentleman brought up earlier. So according to the tentative calendar that you had up there earlier, it doesn't look like cultivation facilities can start to produce until August. Is that correct?
The question is, when can cultivation facilities start to produce or start to cultivate? Well, so the licenses we expect will start to be issued around August?
No.
Or issued in December?
Right, they'll be issued in December.
Yeah, so
You can't start growing until.
we cannot start growing until a license has been issued. That's right, and that's going to take.
My understanding of the wording of the law is that everything has to be produced inside Missouri.
Yes.
So a lot of these dispensaries are not going to have a whole lot of product, right?
They're not allowed to open until they have a license either. So that those things should take place around the same time. But to your point, it's likely that dispensaries will be open prior to having product on their shelves. This has happened in a lot of other states. And so I guess the question always is, well, what are you going to sell?
You're not selling cannabis, I'll tell you that. You're going to train. You're going to train employees. You're going to bring people into the community and tell them how to get a card, talk about it.
What about it?
Nobody's growing them inside Missouri right now, so you have
Right.
to export them and
Right. Okay. So the follow-up question, I believe I'm going to attempt to paraphrase your question. I believe what you're asking is, from where do the cultivators get the genetic material to start cultivating? Okay. I'm not going to answer that. No. I'm just kidding. So in other states, right, that's like the $64,000 question. From where does this once illegal product suddenly materialize from? There are seed banks, not just in this country, but in other countries, that will gladly ship. If you're comfortable making that order and receiving it, they're comfortable shipping it. That's the best, most honest answer that I'm prepared to give you. You have a nice hat. I'm going to call on you.
So exactly how the follow-up question is, our family owns a medium-sized transportation business out of Illinois. What are the legalities of transporting whatever needs to be transported at THC levels crossing state lines when that time comes?
No state lines. That time is not coming for a while. So if you want to operate as a transportation business for cannabis, whether it be medical or adult use in some state, you have to operate wholly within that state. With seeds? No, not unless they are industrial hemp seeds. I believe that the new farm bill is likely to address that and allow for interstate commerce of industrial hemp, but that's different than what we're talking about here today. The gentleman's question was, by the way, what are the rules surrounding transportation of various medical cannabis products across state lines? Hopefully I was able to answer that. Yes, ma'am.
Doctors that are wanting to get prescribed, are they going to need to go to class, do anything different with their licensure or anything like that?
It doesn't change anything with their license, but they should want to take this 2-hour course that MoCannTrade is putting together, because it's the basics of how cannabis works. So it will be our job to get that information out to the physicians and medical community to say, this is available, please take this. We'd like for it to be continuing education if we could, because they all like those credits.
Sir, go ahead. Sorry, I promised this guy I was going to call him. Go ahead, sir.
Piggyback off of what he said. I've been to a couple of these initiative meetings, and I am getting the impression that you have to be certified prior to January 1st because the certification should go up. I'm wondering, is this a falsehood? Is this some kind of scam? Because they're saying you need to get a certification, which this one initiative wants to charge you $10,000.
I'm sorry, who is they? Okay, and what is it that they are telling you you need a certification for?
So you need a certification. They are having classes to get certified prior to you getting a license. And
If you would,
how to set up the grow.
yeah, if you want to talk to me about that afterwards, I'll be glad to spend some time with you. But based on what you're telling me, I would be highly skeptical. Yes, sorry.
You had mentioned in one of the slides about licensure and vertical integration. Did you intend that to mean that there's an expectation that licenses for vertically integrated applications would be preferred, or
Not at all.
there's no
No.
preference for
Vertical integration versus an independent license is one preferred, no.
So the question was,
If you want to have a vertically integrated firm, you have to apply under each of those applications.
Yes, you do.
Receive a license for each of those.
Yes, you do. And you have to pay a fee for each of those. Right.
So-
Be denied in one portion.
Yes, potentially.
the gentleman's question was, will vertically integrated operations be preferable to those giving out licenses than standalones? To our knowledge, no. There will be people who apply for 1 dispensary, 5 dispensaries, 5 dispensaries, 3 cultivation sites, 2 manufacturing, and maybe they'll get 1. So I don't think that there's any preference.
Is there any kind of conflict of interest? I thought I read Amendment 2 that basically a grow operation couldn't also own a license for like a testing facility.
So that's the gentleman's question was, is there a conflict between license holders owning testing facilities? Yes, they cannot do that, but there is no conflict as far as owning multiple types of licenses. So for those of you who don't know, vertical integration is simply owning your own means of production, the distribution of that production, and the ability to sell it. So if you own a cultivation facility, an infused products license, and a dispensary, you are wholly vertically integrated. Are we done? You kicking us out?
One last question.
What does it cost to apply?
You already asked a question. I'm going to ask someone, get somebody who hasn't asked. Go ahead.
I'm a city councilman, and last night after a council meeting, we had a few council people come up and say, how does this impact our municipalities? Is this going to fall under planning and zoning? Is this going to be, are the cities and the municipalities going to have any input in, you know, do we think there'll be dry cities, dry counties, or is that, you know, it's a big question because you talk about the impact. We're unsure also. We don't know how do we, are we going to have to change zoning regulations? How does this impact there for different functions?
You, sir, should talk to this man right here. No, the trade association exists to answer those questions. Amendment 2 forbids local municipalities, whether that be cities, towns, townships, counties, whatever, from banning these businesses outright. However, you all may zone us into places we don't want to be, which is an effective way of making sure that your communities don't have these businesses. And typically when people ask, I always say, look, if you're not wanted, don't go there. Like I don't like to go places where I know that people don't like me. And so I think because Missouri does not have this opt-out provision, and I understand the reasons why it doesn't, but because it doesn't, there will be some conflict between those places who don't want this and people who want to be there. What we are urging people to do is go to these cities. I think Mitch talked about this. Go to these municipalities early. Take their temperature. Find out if they are excited for cannabis and to be part of this, or if they're not, and you can make your decisions accordingly.
Well, I can say I'm excited, but, you know.
Glad to hear that.
Yay, Alderman. Yay, Alderman.
All right, all right. Hey guys,
I'll stay here as long as you folks would like out here and answer any other questions I can.
real quick, I just wanted to introduce myself. I didn't say at the beginning. I'm Andrew Mullins. I'm the director of the Missouri Medical Cannabis Trade Association. Both myself, Mitch, and John will be out in the beer area, and we'll be happy to answer some questions. There is also an office hours for a follow-up meeting. If you'd like to spend some time with MoCannTrade, you can find that on the website. Last question. Somebody had asked about application fees. $6,000 for dispensary, $6,000 for manufacturing, $10,000 for cultivation, right?